We congratulate each of us for getting this far into the program, and I hope that today we can make the best use of this opportunity to create some good work together. This Healthier Population session is very well attended for a penultimate day, but I think it also speaks to the importance of what we're here to work on together. It's, of course, one of the 3 strategic priorities of this 13th General Program of Work. And a new division of Healthier Population has been created through which WHO aims to contribute to the 1 billion people, their better health and their well-being by addressing the broad determinants of health. So talking about that new division, it's being created there for the 1 billion. It brings together different thematic areas addressing the environment and social determinants of health that were previously spread across the organization. And this is the first time that this division will be presented in the World Health Assembly. This technical briefing will discuss the vision for and the work of the new division. What is it about, what it aims to achieve, and how it will go about it. And I think the way we're going to try and do that is to get as many of you involved as possible. If you've been participating in the last couple of technical briefings, we've really expanded the space for you to have your voice included, for us to listen to each other, and then to give some quick feedback on some of the thoughts that are being created around the room. And we also welcome the Director General, Dr. Tedros, for joining us here today for this special session. Welcome, Dr. Tedros.
Speak first.
So I think all that leaves me to do is So I think all it does is welcome Dr. Tedros Adhanom Ghebreyesus to the podium or at the desk, whichever he prefers today, to welcome us with a few words. And as was saying, we've got this new division. Everyone's very excited about it, how it ties in with your broader mandate, with your big vision. Dr. Tedros, please.
I would speak afterwards maybe, but everybody is WHO here.
Okay, so we'll start off like this. We'll be a little different on this last day. Dr. Naoko Yamamoto has also been reassigned to a new position. She's the ADG for Healthier Populations. And Dr. Naoko, I think that there's some important thoughts that you want to share with us here as we get underway.
Thank you, James, and thank you very much, everybody, to join this, the last, but the most important technical briefing. I really appreciate your participation. As James has already said, that last year we decided to GPW, General Program Work 13 for the WHO, and we have 3 strategic targets: 1 billion more people benefiting from WHA, universal health coverage, 1 billion more people better protected from health emergencies, and 1 billion more people enjoying better health and well-being. Our new division, which we are going to talk about today, is mainly work for the 3rd billion, health and well-being. And what's health and well-being for the people and the ground? So next slide, please. I think the people need to drink safe and clean water every day, and people need to eat safe and healthy food. Next slide, please. And also, we need, and people need to breathe clean air. The road to my work are safer, and as an aging person, but I feel valued as an older adult. So next slide, please. To achieve it, our vision is the world where all people enjoy health and well-being through health protection and promotion, preventive actions, healthy environments, and enable healthy life choices. This is our vision of our new division. And our mission is our work will contribute to reducing health inequalities and reducing preventable disease and injury caused by environmental and social determinants of health through a coordinated intersectoral approach to enable all people to enjoy better health and well-being. This is our mission. So we can talk about more detail later by our staff, but during last week and even today, many members says our partner asked what exactly means, where is our existing function go, which department? They are ask us a very practical question. So let me go through quickly about that one. Our new division, UHC Healthier Population, have 2 departments and 1 research center. It's a Kobe Center. And the Climate Change and Health and Environment Department work for the air pollution, water sanitation, urban health, and the chemicals, radiation, occupational health. And the second department is social determinants of health. This department works for social welfare and well-being, violence, prevent violence, road safety, injury prevention, children, youth, and young vulnerable group issues. And health promotion department will work for the governance and framework healthy setting, health literacy, physical activities, tobacco control, healthy aging, healthy cities. And the nutrition and the food safety department work healthy diet and effective nutrition action in the food and the health system and food safety risk assessment. But we are not going to continue to continue the business as usual. We are going to expand our capacity to work for the health and welfare, well-being for people, together with all departments work together in this division, but not only our division, we will work with other division in the headquarters as well as regional offices and country offices to work for it, to accelerate our efforts. And also we are going to expand our capacity. So I would like to hand over to Maria to, sorry.
Before we do that, Maria, do you mind if I just interrupt for 1 second? I think since that we have Dr. Tedros with us, and as you said, Naoko, that there were many questions here, do we have any questions or ideas or comments from the floor? It doesn't need to be a formal intervention. It can be anything and anybody as well. If not, I know some familiar faces here, and I'll just pounce on you. Ilona, you have a comment or a question to make?
Well, I thought I was going to be on the panel afterwards, but
as well,
trust James. I think this is so exciting. I mean, there's this saying that the colleagues from the UK will appreciate. It says, "Football's coming home." And for those of us who were involved in creating this kind of thinking over 35 years ago, I think we have that feeling, football's coming home, that health and well-being is back on the agenda in the WHO, that the determinants are there as an issue. And I might just want to say one thing, because everyone at present speaks about Dr. Halfdan Mahler and primary health care as his legacy. I do want to remind you that the Ottawa Charter for Health Promotion is another one of those children of Halfdan Mahler's. It was his personal objective before he left in 1988 to leave the Ottawa Charter, to give us that as an inheritance. And so I think as we have rediscovered Astana and Alma Ata, we are rediscovering the thinking of Ottawa, and that is fantastic.
Well, as one of the architects of Ottawa, Ilona, and with that broad oversight of what's come before, perhaps you could just give us a quick idea of what you may think some of the challenges may be ahead, or is there a call that you would make to this exciting new opportunity that we have ahead of us?
Well, I think the message in that Ottawa Charter was really the strong link to people's everyday life and the environment. And I think from the few slides we've seen that is reinforced, that, you know, health is created where people live, love, work, and play. And that means that we need to structure environments in a way that they are healthy and that it relates to people's well-being, not a narrow understanding of health. The second thing I'd like to highlight is the Ottawa Charter for Health Promotion is the very first WHO document that highlighted the ecological issue. And there are some very, very strong statements in the Charter that I would really recommend that you go back to. It's about, protecting natural resources. It's really about ensuring a socio-ecological approach to health. And it speaks about the inextricable link between people and their environments. And therefore, the construction of this division allows for an interface. Just think of food, environment, behavior, and downtown with the density of fast food joints, you can really create something new. And I think that's what Dr. Yamamoto said. We don't want to work as usual. We really want to address these wicked problems in a totally new way.
Who wants to add now to the unusual? Yes, we'll go to you, please.
Thank you very much, Shafiqa Nasser, Professor of Public Health, Cairo University. But in the meeting, I'm representing Medical Women International Association. And both my profession in teaching medicine, in teaching public health, and with the non-governmental organizations, we have been promoting I'm very happy to see that you have added these divisions together at WHO, because really nutrition always find nowhere in the organization sometimes. Social determinants are extremely important, and it is very useful for this session to address everything related to these things together, because not one of them is a determinant of health, but all of them together are determinants of health. And I think I mentioned it previously that Dr. Mahler and Dr. Tolba both were the directors of UNEP and WHO, sat together, and we were a parliamentary women's group for health, and we sat in this room and we really wrote a lot of what is discussed today about climate. And at that time, maybe 30 years ago, we were saying it will be too late if we wait without having decisions in these things. And I think these have been addressed in this meeting very ably. Thank you.
Thank you very much, Professor. Who else here has a comment? Yes, we'll go to the middle.
My name is Orana. I'm from Thailand. Just to have questions on the topic. It seems like all the NCDs risk factors are under this division. Why alcohol control is not here? Just to see the more integration in terms of work. Just a question.
Great, and I think Dr. Naoko or Dr. Nera could address that afterwards. We'll take a couple more questions first. Thailand, do you have any other follow-up questions, or that's fine for you? Okay, should we go to somebody else here in the room? Martin Jepsen, what would you like to ask? I saw you putting your hand up there, just there.
Oh, no, I didn't put my hand up, in fact, but I will come back on the second panel. Thank you.
Yunhui, you have anything? She's very shy. Who else is there here? Okay, so perhaps Dr. Naoko, and if you have questions, especially from civil society or from member states, please put up your hand. I can still get to you. Dr. Naoko, would you like to respond to why isn't alcohol control up on that screen?
Thank you very much, and especially a question from Thailand. First, Thailand mentioned about NCD, and NCD prevention, health promotion, and population approaches work with my department, but also the disease management is another group, and also UHPHC need. So as WHO, we are going to work together with the other division, and we are going to create a steering committee and also internal coordination mechanism to work together. Regarding the alcohol, of course, we talk about in a healthy diet, including alcohol, but also the mental health group work with alcohol addiction and together with other substances or drugs. So again, maybe Tedros, our DG, will say that, but our not work as a department only or one department only or one division only. We are going to work together for the health. So thank you for your questions.
Is there any follow-up that you'd like to ask to that, or is that okay? Okay, fine. We're going to the delegate to that side of the room, please.
Yes, thank you. I'm Wendy from Suriname, the Ministry of Public Health. I just have a question for clarification. Under social determinants of health, of course, a few are listed, including children, youth, and vulnerable groups. I was just wondering what is it really, what about this group is being highlighted as social determinants of health? I'm just wondering why it's listed there.
Okay. Can I? Oh, okay. Thank you very much to point out. Still, we need to discuss about detail, but during the discussion about social determinant of health, we have some idea about the focus on some special project or program focus on the overcome the health inequality in some vulnerable group. But obviously, as you said, that's to approach and also work for the vulnerable group is not only the one department issues. So I just received your message. So maybe in our new program and new clear vision program will come later.
Thank you very much to Dr. Nelko, Dr. Tedros. I know that you were listening to some of the different strands of thoughts that were coming in there. And of course, you have words of your own to share with us today. Very exciting, says some of the delegates, about the vision ahead. Please, can you share some of your personal thoughts behind this new vision?
By the way, I would be happy to speak after others have spoken, because that was in the program. I see that I'm expected to speak afterwards. So I will keep that for later. The only thing I wanted to say here is in response to what was raised. Mahler was, I think, mentioned here twice today. Of course, many times during the assembly. I remember in other side events and briefings also, especially when we're now promoting healthier populations and with UHC, a strong primary healthcare foundation, and primary healthcare being his legacy, it's not surprising, as what Ilona said. So we're very happy that we're focusing now on healthy populations, plus focus on primary healthcare as a foundation of UHC. Maybe to share with you, we have some 2 or 3 things in common with Mahler. So I'm trying to associate myself. One, he's from Denmark, and his own country influenced him on his belief on health for all. And mine also, my own thinking, and especially my strong belief in health for all came from Denmark too. This was in 1988 when I visited that country to have a training for 4 months, and when I had a health insurance cover for 1 year, although I was staying for 4 months. And I was saying, what is this country? And that I really appreciated personally, but at the same time said, this should be done everywhere. And that influenced me greatly. So Mahler was influenced by his own country, and a visitor like me also was influenced by Denmark. And then the second is his middle name is Theodor, by the way. So we have a common name. So I'm Theodor, Tedros, and he's Theodor too. And the third is, although we both believe in primary health, in health for all, but I'm a very strong believer of primary health care. And that's why most of my first few years, especially my 5-6 years in Ethiopia as health minister, was not exclusive, but for the large part, my focus was on primary health care. And we had to build it. And there was a strong political commitment by the government. That was the opportunity I had, and it was done. So that's the third one, the strong belief in primary health care. Anyway, I am associating with him because I really believe in him, believe in Mahler's thoughts and beliefs which I share, and I can consider myself as his follower, to be honest. So that's what I would like to say with regard to my belief and something I wanted to share with you. Then on healthy populations, there are 3 pillars now. We have UHC, emergency, and healthy populations. These are the 3 major pillars we have. And healthy populations, as many of you have rightly said, addresses the root cause. And I was reading the Ottawa Charter, and it goes into the roots and what enabling environment actually brings health to populations. And the fundamental conditions and resources for health are, it says, peace, shelter, education, food, income, a stable ecosystem, sustainable resources, social justice, and equity. And that's why we're saying we need to go into the roots. And that's why we're saying health in all policies. That's why we're saying multi-sectoral approach. Health cannot, especially healthy populations, if we're talking about a bigger sense, the well-being itself, it cannot come by our investment in the health sector. It's investment in the environment, investment in other areas can bring actually more health to the people. And by doing that, we prevent people from going to hospitals in the first place. And that means people are healthy, but at the same time, it's savings also. We're saving money too. But the other important element is when you talk about healthy populations and health promotion, it's enabling people to increase, control over themselves and to improve their health. And you can take health as a product in that sense. When people know how to prevent malaria, for instance, or avoid the risk factors because they know they're aware, it means they're producing their own health. Health as a product. You can take health as a product that can be produced by an individual. So in addition to the factors, the social, economic, and so on, commercial determinants that should be addressed by governments and so on, there is the other dimension that the individual also is taking responsibility. So in both, you address the root cause, whether the individual is taking over or something that can be done by the government or other institutions is done by them to bring better environment, and that assures better health for individuals, but not only that, as a society too. So what you have raised is really important, and we're moving in that direction. And we will give even more and more emphasis to healthy populations, because the investment in that area is, its dividend will be really, really significant. And we're committed to really push and strengthen that arm of WHO, which has to be, of course, the case, and many of you agreed. Thank you.
Thank you very much, Dr. Tedros, for underlining that commitment that you've outlaid over here. If there are any comments to that, yes?
Yes, thank you. I'm Taru Koivisto from Finland, from Ministry of Social Affairs and Health. Thank you so much for this information concerning a new organization of WHO. As Ilona was already said, it's very positive to see that all these important issues are put together, and now there is an opportunity to have broad-based activities to promote the health and well-being of people. And especially important is to have this opportunity. We think it's very good to have, for example, aging as one of the issues there. So that aging is not just services for the elderly or narrow perspective, but to include it there, because for Finland it's a high priority, as I know for many other countries as well. And of course, having this broad perspectives, there's a lot of activities going on in WHO. Health in all policies is such an approach which we in Finland have been promoting for a long time, and there's a lot of initiatives in there already available in the organization. So take forward this and use as an opportunity to proceed. But of course there are challenges, and we heard that there are, for example, risk factors nowadays will be in the future in other division. So there's a challenge to get this together and work together, because you can't separate, for example, NCDs and the risk factors from health promotion and protection of health. So we are looking forward to the future and seeing good progress there in the new organization. Yeah, thank you.
I think it's important that we make use of this opportunity by also ensuring that we have a range of voices here represented, and we've also got, of course, civil society. I know that you'll be joining us later on the panel, Rosamund Adukisi-Debrah, who is with the Ella Roberta Family Foundation. Ella Roberta, it was her daughter. She was the co-founder. It was set up after the death of her daughter 6 years ago from a rare and severe form of asthma. Thank you very much for being with us here in Geneva. I suppose one of the questions that I wanted to ask you was, do you think that people know what causes health in their daily lives?
No, and for me, the key is always going to be in the message, raising, no matter what you do, raising awareness is going to be key. So the people you need to get to need to hear the message. If they're not hearing it, we can sit here and we can all be in agreement. However, the key will be in the messaging that you put across for certain populations who they may not be as well educated or be very deprived, and they have other more pressing issues going on. So raising awareness, I would say that as an educator, you see, is always going to be key from my point of view.
What are some of the ways in which we could do that in ways that might have made a difference? Maybe not for your daughter, but for other children in the same position as well. So one of them was education that you said. So in terms of, you said, enhancing that message across. But what are some of the ways that you can reach people who really are vulnerable, people who don't have the access to normal tools of communication?
I'm going to go for the health professionals. I'm going to maybe pick on doctors, sorry, because doctors, they have a responsibility. They are the one set of people that see all these patients that come to them. So they need to find a way of getting the message across to their patients. So I'm going to have to say doctors, because ultimately that's where most of the people will end up in hospital. But governments also, I won't try and lecture governments too much, but in my opinion, when it comes to what I'm fighting about, air pollution and the impacts on health, it has passed many people by. There are an educated set of class who know all about it, but I'm sure if I go into most countries and speak to the ordinary person on the street, they may know about air pollution, but they may not necessarily know about the impact on their health, which is extremely important.
Rosamund, then you've got this additional factor today where we're living in a digital age, and I've already, I think, indicated that not all of us have access to social media tools. I think sometimes we can sometimes lean too much on digital media, and people say that that's the way to innovate. That's not always the case for people who don't even have access to that or time to access it. But you were talking about air pollution, for example. I mean, where do you go forward from there? How do you get people to be touched by information? So it's not just messaging, but it's messaging that moves them into action.
You go into the communities and you talk to the people, and that will show them that you care. everybody cares about their children and their children's health. And there are always, you know, we describe these communities as difficult to reach. They are not difficult to reach at all. We need to actively go in there and speak to them. We need to give them the information for them to be proactive. Prevention, by the way, is always going to be better than cure.
And I know we're going to meet you a little bit later properly, but just to contextualize your comments, perhaps you could introduce yourself quickly and some of the settings in which you come here to join us today.
My name is Rosamund Adukisi-Deborah. I am the mother of Ella Roberta, who probably had one of the worst cases ever of asthma in the United Kingdom. Before she died, I was a teacher, and now I am a children and young people advocate. I care passionately about children and education. Thank you for having me.
It's a real privilege to have you with us, and we'll be hearing a lot more from you later in this technical briefing. Just a reminder, of course, that we are available in all 6 official UN languages, so if you want to do your intervention in one of those languages as well, of course, you're very welcome to. Are there any other comments from the room?
On the aging, maybe?
Yes, we had the comment from Finland on the aging. Dr. Tedros, would you like to respond to that?
No, just on the aging, again, the most important thing in aging is having a healthy aging. And many countries are moving towards that direction and away from putting older people in nursing homes. Elderly people, very few of them who have serious health problems can be dependent, but that can happen at any age, actually. But it's not the age which is the problem. There could be a healthy aging, and it's in the position of countries where the problem is. It's the way you take it. You can have some countries treat it as something negative and call it silver tsunami, while others are now shifting towards calling it silver dividend. And in both ways, it's the way you take it. If you consider aging, the healthy, the aging population as part of your national development, then you can use their skills or skill sets or competencies until late their life. Some of them, of course, they may have skills that cannot be applicable during old age. In that case, you can retrain them, and they can have skills that they can still, so they can still continue to contribute to society. So, healthy aging, especially considering the elderly as part of the national development, and instead of considering them as consumers or dependents, if you consider them as contributors, then that can address, even contribute to the health of the aging itself. It's when they stop being active that they get into trouble. It's when they feel that they're dependent, then that's when it actually accelerates their, all the problems that you can face when you get old. So that, I think, has to be corrected. And many countries, very encouraging to see that many countries are taking it. So we need to move from that silver tsunami concept into a silver dividend and consider them as active players of the society and treat them as such and address their problems in order to keep them healthy and contribute, and it will be the responsibility of all sectors. And that's why now we're putting it under the healthy populations. It's not a disease, it's about healthy aging, and that has to be done. It has to be in the healthy population itself. James, thank you.
Thank you, Dr. Tedros. We have a comment from the gentleman there, then we're going to move to the center of the room in that order.
Thank you, James, and thank you, everybody else. My name is Mike Dünbier. I'm the Director of Strategy and Advocacy at IOGT International. We are the premier global network for achieving health and development for all through alcohol prevention and control. This is really a fantastic conversation for us to be part of, so thank you to Dr. Yamamoto and Dr. Tedros for sharing a few thoughts about this new pillar. I have one question about the risk factors. I think it's excellent that it's already coming up. And to contextualize the question, I just want to share two facts. The harm alcohol causes in India costs more than the entire healthcare spending of the country every year. Fact number one. Fact number two is last week on Friday, or I think on Saturday actually, we discussed WHO's work on women's, children's, and adolescents' health. And nowhere in this report did it mention children from families with alcohol problems, fetal alcohol spectrum disorder, alcohol as a risk factor for violence against women, and alcohol in adolescents. So my question is, knowing this and how much alcohol as one risk factor impacts UHC and the emergency pillar, how is WHO planning to work in making sure that these risk factors are addressed properly across the different pillars, across the different departments? We would really like to learn about your approach in the future. Thank you.
Thank you very much. And to the delegate here.
Hello, I'm Professor Azad. I'm the Director General of Health Service from Bangladesh. Actually, all these issues, to address these issues, this requires multi-sectoral engagement and a strong intersectoral coordination. But the fact is that actually within the organization, there is lack of coordination. Within the health ministry, there is lack of coordination. But actually to put control on the limited resources we have, actually to gain efficiency, we need to ensure a strong coordination between different sectors. So actually how WHO actually is addressing this problem so that actually we can use these limited resources very efficiently to ensure that the more gains are actually achieved through our interventions.
Thank you for that contribution from Bangladesh. Is there anyone else here in the room? If I'm missing you, just, yes, please. One here and then there.
Hello, everyone. My name is Amro. I'm a medical student from Egypt. My question is, it was mentioned before that physicians are the one responsible for delivering the message to the people about how to be more healthy. However, in many countries, there's still the medical curricula are lacking the social accountability of the physicians and medical students. Just my question is, or it's not a question, it's a comment about that we really need to emphasize more in the medical curricula for the medical students about the role in tackling the health challenges we have now, and to give them the tools necessary to deliver the message to the populations who are not available to get it from somewhere else. Thank you.
And who do you think is best placed to help make that happen for you?
I think it's advocacy in medical schools itself, and maybe pressure from the government or like the ministers of health on the universities, because I think it's not clear. Like it's not clear all the time that medical doctors have the social accountability and responsibility to go to people and to deliver the public health messages. Thank you.
Thank you.
Hello, Lian Como from the International Union of Health Promotion and Education. I applaud this new division. I think it's wonderful to hear that health promotion and social determinants of health are front and center in this initiative. I do hope that the member states will follow suit and implement some of this, because we know that it's very challenging to act for the long term rather than short-term goals. Thank you.
Thank you. We're going to go now to the delegate in the first row there, and then behind you after that.
Thank you very much. I'm Inoka Suravira from the Environmental and Occupational Health Directorate of the Ministry of Health in Sri Lanka. I'm very excited about this change, and I think this will really go on very well. Because as the Ministries of Health, we always think of the health of the children, the mothers, the school children, the adolescents, and of course, we care about the healthy aging. But there is always a missing link that is about the health of workers. So I suppose with this new development, we will be able to promote health throughout the life course, so that, as the objective says, that we'll be able to promote the health of 1 billion people in the world, because workers are like 3 billion, so we cannot forget about them. Thank you very much.
Thank you. My name is Mikel Lejean. I'm from Corporate Accountability. I'm very happy to see the range of topics being covered under this division, and also appreciate the extent to which it covers many of the SDGs. One thing in relation to an intervention that I made during Committee A is the role of transnational corporations in driving the very epidemics that we're speaking of. I think in relation to climate change, one perspective is that the top 100 corporations contribute to 71% of global emissions. There's over 1.2 billion people in the world that do not have access to electricity. Half of those people reside in Africa. I think that it is important to remind ourselves not only of the choices that people have in their day-to-day lives, but the actual extent that systemic change can bring about in addressing many of these issues. We have campaigns on addressing the water privatization that impacts so many people globally, where profit is prioritized over people's human right access to water. Our food campaign talks about the driving of the food industry and people's access to healthy food. And I think our tobacco campaign has been guided by the principles of 5.3 and Article 19 and the liability and accountability of tobacco industry. And I think that it's important that, given the span of all of these areas of work and the role that profit-driven corporations play in driving many of the epidemics we're talking about, that is elevated and ensured to be protected against. Thank you.
Thank you. Can we move now to the center of the room?
Yes, I'm Horatio Ruda. I'm a chief MOH of the province of Quebec. I'm happy to see that the organization is making that change for integrating the different aspects of the determinant of health. We have been adopting a health in all policies approach in our government, and I think one very important issue is, as any plan, is that the top level of the government be aware of those aspects and how we make our ministers, our environmental, agriculture, economic, transport, how to go there in the follow-up of a plan. I think the governance issue is a very important one if we wanted that to happen. We've done the work at the administrative level in between ministries, and now we are going through 2 governments and we are staying on that aspect. So I think it's very important for me to express the role of the governance if we want to have the investments and that education, work with family, with health, environmental, and transport. That's my comment. Thank you.
Thank you. Before we move now to Dr. Nera's presentation, I just wanted to ask Rosamond whether you have a last word on this. I look across in your direction, I see the 2 young children sitting next to you. I think we should have more children here in the Palais during the assembly. And of course, we're here to